Hi, welcome. I'm going to teach you and review going over PD dialysis, peritoneal dialysis, and we're going to start from the beginning. In this video, we're going to start from setting up the machine and all of the lines with the bag up to priming the machine. In a second video, we're going to do from priming, once it's finished priming, to connecting up the patient. So that'll be video number 2. To start, you have to start with your PD bag, your bag of Dianyl. And Dianyl, you're going to have to make sure that it coincides with what the doctor has ordered. So the doctor could order 1.5% of dextrose, 2.5%, or 4.25% of dextrose. The calcium typically for us is low calcium 2.5. The doctors may choose to add heparin or antibiotics or different additives to the fluids. If that's the case, it has to be brought up to pharmacy in the bag, up to pharmacy so that they can add the additives for you. That will take the pharmacy at least a half an hour, so as soon as you get that Dianyl order in, bring it up to pharmacy. Once you do, you want to try to get the bag on the heater within a half an hour of planning to start the PD so that it has time to warm up so that the patient isn't getting cold Dianyl. So we're going to start that. We're going to say that this patient needs no additives, so we're just going to start with this fresh bag. Take it out of the bag. It's very loud, sorry. And here's our nice bag of Dianyl. We're going to put it on the heater, and we would just turn the button. If you can see, there's a button on the back. That's just the on-off button. Just going to simply turn it on a half an hour prior to starting the PD to warm it up. If you don't have exactly a half hour, that's okay, but as close to as you can. Now, when it's time to start the PD, we're going to bring in a scale and weigh the patient because you're going to need to set the weight on the machine in order to give proper dialysis for the patient. And you're going to need an accurate pre-dialysis weight, and typically you need a post-dialysis weight as well. So we're going to weigh the patient. Pretend we have a scale. We're going to weigh our patient. Okay. And then we're going to bring in a buddy, and we're going to have somebody come in with us and check the bag. So bring in a cow, the computer's on wheels, bring that in, have that in the room set up next to you so that one nurse can look at the machine, the order on the machine, and one person can be checking the bag. So what you're going to do is you're going to make sure you scan yourself, scan the baby, scan the bag of Dianyl. There's the scanner right here. And then you're going to have your witness, whoever came in the room with you, scan themselves to make sure that they have, that they're verifying that it's the right bag matching the order the doctors have put in the computer. Once that's done, now you know you have the right machine, okay? The right bag. You're going to bring up on the computer the orders for the Dianyl, for the peritoneal dialysis. You've already checked the Dianyl, now you're going to check the peritoneal dialysis orders. Okay, you're going to pull those up on our well that's sitting up over here, okay? You're going to print off the policy, the PD policy. You can find it on the Infonet, PD policy, about halfway through, set up and initiate PD. Every step that you have to follow throughout the setting up, from turning on the machine to comparing it to the order, is all in here. So for adults or for larger patients, they use standard mode. For most of our patients, we're going to use the low fill mode. In order to access the low fill mode and program it, we're going to have to use the nurse's menu. It's very secret. So to access the nurse menu, we're going to turn off the machine in the back, that button I showed you before. We're going to turn off that machine, that button. Then while turning it on, push your finger right next to go. Push. There's nothing you're going to feel there. It's just there. Turn it on.
You'll hear a beep first.
There it is. So now you're in the nurse's menu. So now we're going to follow this paper, and we're going to have your buddy, the nurse that you brought in with you, is going to help read through the steps with you so that one person is focusing on what the machine is saying and one is focusing on what the policy is saying. Okay, so Colleen here is going to help me a little bit. So we're entering the nurse's menu by pressing the control panel to the left. We're going to press the go button. Nope. Mode. Nope. I'm going to scroll. There we go. So you hit the enter button. This is why you have a buddy with you. The mode will appear, and we want to be low fill. Okay? If you have to change it and you don't want low fill, if you hit enter, it starts flashing. You can change it to standard or low fill. We want low fill, so we're going to hit enter. Then we're going to scroll down. Here, we'll show the balls. Can you see them?
Show paper?
Yeah. Just so that you can see. So then you're going to press down, and every step is on here. So Colleen's going to read it through with me.
Okay.
So next.
So minimum drain time is 85%.
Yes. Oh, sorry. Minimum drain 85%.
Minimum drain time is 3 minutes plus 1 minute for every 100 mLs of fill volume.
So this number will have to be calculated by the doctors and by you. You can verify it with them. It's frequently something that's left out of the orders the first time the patient has peritoneal dialysis orders placed in the computer. So you can just kindly remind the resident or attending to calculate the minimum drain time. So it should be in the order at all times. So this patient is going to be 9.
Negative UF limit set at 50% of fill volume.
Okay, negative is 50%.
Positive UF limit usually set as off.
It's off.
Smart dwells, yes.
Yes.
Heater bag empty, no.
No.
Tidal full drains, yes.
Yes.
Language, English.
Yes.
Flush, yes.
Yes.
Reset weight, yes.
Yes, because we're going to reset. We checked that weight before. We're going to reset it each time.
Program locked, no. Once all settings have been modified, press stop.
Stop.
Nurse's menu will appear and turn the cycler off.
Okay. So all of those things she just read straight off the policy, okay? And they're all in there. All right, so once we've programmed the nurse's menu, now we're going to program the machine to match the orders for that specific peritoneal dialysis cycle that the doctors have ordered. So we're going to turn the machine back on. And this time not pushing the nurse's menu. So that's already set. Nurse's menu should be reviewed every time before starting every cycle. So low fill volume mode, that's what we programmed before. So to program, based on the doctor's orders, we're going to hit the down button. When it gets to change program, we're going to hit enter. Okay? So now we're going to follow this based on the doctor's order. So I'm going to say the therapy is CCPD/IPD. Is that correct?
Correct.
The total fill volume is 4,000 mLs.
Correct.
The therapy time is 10 hours.
Correct.
The fill volume is 400.
Correct.
The last fill volume is 0.
Correct.
The weight for the patient is going to be in kilograms, so that's correct. And then we're going to hit enter to change the weight for this patient. We're going to put it up to 11. And then hit enter. When you're done with this is the last step. You're going to hit stop. And it's going to tell you it's 10 cycles. And each dwell time is going to be 49 minutes. The machine programs that for you. Sometimes the doctors will put in approximately an hour dwell, but the machine will program it for you. You can't control that. So now your machine is ready to go. So we're going to gather up our supplies. Again, we're following each step of this, and you're still going to have a friend in the room with you, another nurse in the room with you to verify. So we're going to gather our supplies, including face masks for the nurse, patient, and anybody else who's in the area. The patient, depending on age, will keep on the mask or not, but parents should have the masks on as well. Okay? So we're going to press go to start, because we've already gathered my mask and my gloves. So it's going to tell you and walk you through every step. So first we're going to load the set. Because this is a low fill volume that we're using, we're going to use a low recirculation volume set. There's a standard set as well, so if you have a larger patient, greater than 20 kilos, or you're giving greater than 1 liter for each fill, then you're gonna use a standard set. It will say standard here and not low. Okay, so we're gonna open this guy up. Okay. All right, and this guy, if you lift this, this then opens. This fits in, and it only fits in one direction. So if you put it in this way, it's not gonna work. So flip it upside down and push it in, and these will come out here. You make sure that they're lined up and not kinked. Push it in and close it. This blue set fits onto here. So it hooks there, and then it snaps in down here. Okay? This one had one that came disconnected, it goes there. That happens sometimes. All right, so we have now loaded the set. So we're gonna look back and make sure that we have what our next step is. So remove the disposable set from the package. We're gonna close all the clamps. So there's a fair number of clamps on here. We're gonna close each one of them. And you have somebody else in the room with you to verify that all of them have gotten closed. 1, 2, 3, 4, 5. Okay? We're gonna open the door. We already put that in. We're gonna attach the drainage bag to the drainage line. This first one is the drainage line. This next one with the red clamp is for the heater bag. So red hot goes to the heater bag. The next two are for extra bags if you need extra, if it's gonna be more than a 6-liter bag. And this blue one is if the last fill is a different concentration than the current bag is here. All right, so we're going to attach the drainage bag, which we have here. It comes with multiple drainage bags in a set. You can just take one out and you can use the next one, the other drainage bags in the future, for future PD cycles. All right, sometimes it starts off quite tangled. We're gonna untangle this. Okay, because once it's hooked up to the patient, it's hard to untangle anything. All right, so we're gonna take this and we're gonna clamp these. We're gonna connect up here. Not touching anything, making sure it's nice and clean while you're connecting it, okay? Take a blue chuck or two so that it's not touching anything dirty on the floor. All right, so the large clamp, everything's gonna be checked. Then we can say self-testing. We can press go to display self-testing. It's gonna take a little bit, sorry guys. All right, so now it's telling you to connect bags and open the clamps. So prior to doing that, we're going to take our mask, put our mask on. I'm going to wash your hands at the sink. Make sure they're good and washed. You're going to put your gloves on. And we're going to connect up the heater bag, the heater line, the red one. Again, untangle as best you can. And we're going to connect that up to the bag. They have nice little hooks for your fingers. Make sure nothing is touching. And they just pull, it's not a twist. Just pulls off and then this twists on. So the caps pull off, but then you twist it onto the bag. Okay? So it's connecting bags. There's a flange in here, I'm not sure if you can see. Then that just snaps open, and just make sure that you can see that there's a break where fluid is between the connectors. Now you're going to open up the lines that you need. So we're going to need the heater bag to be open. We're going to need the patient line to be open. And we're going to need the drainage bag to be open. Just this one here, okay? This bag, this line here, is for specimen. I'll get to that in a minute. We'll show you where to put the specimen bag, okay? So now, all of our lines are open, except for these three, okay? So these three were not in use for this patient. So we're gonna connect them, and then we're gonna press go. And now it's going to start priming, and it's going to take a while to prime. It takes anywhere from 5 to 10 minutes to prime through the whole machine. You should stand and wait and make sure that you can see the first flow of fluid into the line so that you know that it's working. And then you're free to leave the room and finish everything before coming back. Once this machine is primed, we'll come back to you with a second video of what to do once it's primed.